So imagine you go to the hospital for surgery, and while you're under anesthesia, you're given a pelvic exam without your consent. This is real. A 2022 study from the Hastings Center estimates it's happened to more than 3.5 million patients just in the last 5 years. And that estimate is a rough one because people can't report this has happened to them if they didn't know about it. And many don't, again, because they're completely under anesthesia when it happens. In the last few years, some states started passing laws to protect patients from this happening. And tonight, the feds are stepping in. Heidi has more on this disturbing truth. Heidi?
Now, Jana, the U.S. Department of Health and Human Services released their guidance Monday and says it's meant to clarify hospital consent requirements. They say informed consent is the law and essential to maintaining trust between patients and providers.
Over the years, there have been stories of patients being put under, unaware a sensitive examination like a pelvic exam is happening. These exams were not done for medical reasons, but for learning purposes without their informed consent. In response, the Department of Health and Human Services sent a letter to the nation's teaching hospitals and medical schools reiterating and clarifying its guidelines, saying consent from patients is a must.
We can train people in a way that we can still be sensitive to other people's bodies.
Dr. Erin Stevens is an OBGYN at Clinic Sophia in Edina and legislative chair for the Minnesota chapter of the American College of Obstetricians and Gynecologists.
I remember being in medical school, and I remember being on my general surgery rotation. A resident told me when we were in the OR, a woman was there for an appendectomy or something completely unrelated to gynecologic care, and he said, "You're going into OBGYN, right?" And I said, "Yeah." And he said, "Well, then you should probably practice a pelvic exam on her. You should do that as much as possible on anybody you can. They're asleep, it doesn't matter." And that message of it doesn't matter just because someone's asleep, like says so much about our society in general, right? Women's bodies are kind of a commodity, and we don't have control of our bodies in so many settings. But to have that in the setting of my medical education as the message that is being brought across to both patients and learners, that's really scary, and it's just a really icky feeling.
The new guidance requires written consent from patients for breast, pelvic, prostate, and rectal exams, especially if patients will be under anesthesia.
So it's primarily about medical learners. In general, it is stating, though, that nobody should be performing these extra things that are outside of the scope of the actual procedure. So specifically, if a patient is coming into the emergency room, are you doing a pelvic exam that is not needed for the scope of care?
If hospitals do not follow through, they could risk losing funding from Medicare and Medicaid,
which is basically how residency programs run, so that's a huge deal.
There have been reports of people who liken unapproved exams to sexual assault.
I think as a society, we're getting better in general at figuring out what is right and wrong to do, especially when it comes to bodily autonomy. And knowing that, at least 1 in 3 women probably experience sexual assault in our lifetimes.
Many hospitals already have policies in place. For example, the University of Minnesota Medical School told KARE 11 it, quote, already follows the standard of obtaining and documenting patient consent before an educational exam is performed under anesthesia. Dr. Stevens says people also volunteer to allow medical learners to do exams on them.
But that is a mutual consent situation, and this should not be done outside of that.
25 states have passed laws regarding this requiring consent. Here in Minnesota, Republican Representative Kristen Robbins in Maple Grove has been trying to get a law passed for years. The bill has never received a hearing. And Jana, it looks like it's effectively dead once again this session.